Welcome to the DoubleACS Daily News. Both the CDC and the FDA are now recommending that people in certain age groups and professions receive a COVID-19 vaccine booster shot. DoubleACS spoke with Sturdy Memorial Hospital's Chief of Emergency Services to learn about the status of COVID-19 in the area and to learn more about the vaccine booster shot.
Hi, my name is Brian Patel. I am the Chief of Emergency Services at Sturdy Memorial Hospital and the Associate Chief Quality Officer, and have been overseeing the COVID response for the hospital for the past 18 to 20 months. For this region, unfortunately, are probably one of the lowest vaccinated rates in the state of Massachusetts. Out of the population of this area, about 58 or 59% are fully vaccinated, and then of those eligible for vaccination, it's about 68%, whereas in the Boston area, you're seeing numbers upwards in the high 70% range. And so I think that, we're seeing a higher number of COVID-19 at Sturdy than some of the surrounding hospitals, and I think that in part is related to our lower vaccination status. It's hard to know exactly why this region in particular has a less vaccination. I think that there's been plenty of access to vaccine. You can go to CVS, Walgreens, any of those areas. There's multiple different ways of getting vaccination through the state, through mobile vaccination sites. We have held a walk-in clinic at our clinics in the outpatient to allow people to come in and get vaccinated. We've been offering vaccine when people come into the emergency department and when they get admitted to the hospital, and offering COVID-19 vaccine during that time as well. So I think the access is definitely there. It's hard to say why, in particular, people aren't in this region are not choosing to get vaccinated. So there's two different categories around the booster vaccination right now. So what's approved right now is that anyone who is considered immunocompromised, so meaning that they are actively being treated for cancer and receiving chemotherapy, are a transplant patient, or are receiving medications that suppress their immune system, are eligible for the booster vaccine now. And they can get that vaccine 28 days after their second shot. The booster is only approved for Moderna and Pfizer. And the recommendation is you get the same type of vaccine that you got the first two times, but it's not a requirement. So if you got Pfizer initially and you're not able to get Pfizer for the third shot, it's fine to get Moderna. But if you can get the same, you should get the same. The second population is expected to be fully approved sometime in September, and that is meant for the general public, that anyone who 8 months after their second shot is eligible for a booster vaccine. And that's based on studies that have started showing some waning antibody levels in patients after that time period. And so we're still awaiting full approval on that process, and so that has not been rolled out yet. And so we're still waiting to do that, but we are in the planning stages to set up clinics to allow mass vaccination for the boosters, as I'm sure there will be some initial high demand for patients that were vaccinated back in the December through February timeframe. There's been a lot of misinformation, I think, around the use of ivermectin for treatment of COVID-19. There's really been no good data that supports the use of this medication for treatment of COVID-19, and is not recommended or approved by the FDA to be utilized for treatment of COVID-19. Unfortunately, because of information that's out there, people have kind of convinced themselves that it is the treatment of choice. They've heard stories where people have taken it and recovered from COVID-19. Obviously, in those cases, you have no idea whether they would have recovered anyway, and there's nothing that shows that the drug itself caused the recovery. But the drug does have a lot of side effects. One, it's intended for an animal population for the most part, and so where they're getting the medication from is in much higher doses than you would necessarily administer to a human, because it's used in the horse and larger animal population. And so there's a lot of toxicity around ivermectin, and we're seeing we haven't seen any here at Sturdy, but throughout the country, they're seeing cases of people coming in with toxicity around that medication. And so I extremely highly strongly recommend that you do not try to get access and take that medication. It is not recommended or approved for use for COVID-19. There's nothing to really clearly predicts whether you're going to get mild or severe COVID-19. You can be young and healthy. We've seen 30-year-olds that have been unvaccinated and had very severe COVID-19. And so being healthy does not necessarily prevent you from getting severe COVID-19, and so you need to consider that as well. Vaccine is available everywhere. It's easily accessible. Learn about the safety of the vaccine, and then please get yourself vaccinated, because it'll protect yourself, it'll protect the spread of COVID-19, and ultimately prevent us from having more future surges as we continue to go through this for the fourth or fifth time.